Today, we're going to finish up chapter 2 by answering a very simple question that is, how many people will inhabit the earth in the future? Our lesson today is entitled Population Change and the Future. A couple questions we need to answer is possibly someday, are there going to be too many of us here on earth? Demographers try to figure this out. Is our population going to stabilize in the future? Will it increase? Will it decline? These questions are answered by the United Nations, and all of the maps and all of the facts that you see today are going to be based on their findings. Well, if you start and you look at this chart here on the front slide, you'll see that there are fertility assumptions, and basically future populations depend primarily on fertility, all right? Women having children. You have to have babies to increase the population. The map chart does a real good job of showing you the low ball figure and the high ball figure from our present year here in 2020, where all the arrows are pointing and close to it, to the year 2100. That's what we're doing, and that's what we're keying on today. All right. So if women around the world have 0.5 children, the low number would be that our population is going to obviously shrink to about 7.2 billion people. That's not happening. All right. Guarantee that's probably not going to happen. There has to be a devastating phenomenon on Earth for that to happen. You can see the median, which is a little bit more realistic at about 11.2 and so on. And then you can see the high number in red, that our population, according to some people and some stats, are that it will grow from where we are at right now, somewhere around 8 billion, and double by the time the year 2100 comes. There's a lot of reasons for this, okay? And that's what our lesson is all about today. Now, population futures is the first thing that we're going to talk about. And when you did your My Country activities, you found out in your research that there is a possible next fifth demographic transition stage, and it is called stage 5. Many of you asked me questions, but Mr. Hamilton, I thought that the demographic transition stages went up to only stage 4. Well, there's a possible stage 5 in our world. Now, stage 5 of the demographic transition is characterized by very low childbirth rates, very high death rates, and a declining natural increase rate. All right. When countries experience this, they go through a possible demographic transition, what we call stage 5. If there was one country on earth that this was going to happen, or presently is getting close to happening in, it's Japan. There are few young women having children. This possible stage 5 is characterized by obviously a small amount of young women having children. Japan would be it. It's getting very close. The population of Japan declined from 128 million people to 84 million people from 2000, or expected to be from 2010 to 2100. Now, when this happens and there are few babies or a lot less babies being born, there's an increase of the number of elderly people. Now, when a population experiences an increase in the number of the elderly, one very common effect of that is there's going to be a shortage of workers. This can definitely affect the economy in a big way, and it's something that the country of Japan is already preparing for if this happens. Now, to combat the shortage of workers, Japanese women presently, right now, are making a choice. Do they choose to go to work, or do they become a mom? Or do they become a mom? And it's an interesting concept that a woman has to make a choice these days in our modern world to have a family or go to work, all right? In a way, these Japanese women are making decisions to help their country in a way, and are loyal patriots. Now, you can see the population pyramid that we've been working with this chapter, and you can see what Japanese population pyramid looks like in 1950. And then look at what it could possibly look like, the projection of it in the year 2050, all right? What a huge shift in 100 years and so on, okay? And that's a good example to show you this possible demographic transition, stage 5. Japan would probably be it. Now, there's other communist countries in the world that could be going through this as well. Former communist countries like Russia. Russia has experienced high CDRs and low CBRs simply because the people haven't trusted the way of the world for the last 50 years with nuclear warheads and in communist countries. The instability of the government has made people not really want to have a lot of children, okay? So communist countries or former communist countries like that also could possibly be an example of countries that are moving towards stage 5 in the demographic transition. Now, what better countries to look at and break down why population change might change in the future and what affects it than China and India? Now, we know that these two countries are heavily populated. In fact, more than 1/3 of the world's population live in India and China. Now, we get introduced at this point in our lesson to two topics or two terms. One is called pronatalist and the other is called antinatalist. Governments around the world are either pronatalist or antinatalist. And it's a very simple concept to understand. Pro means that you're in favor of it. So a pronatalist policy is a government policy that supports birth rates, all right, higher birth rates. Antinatalist policies are where governments obviously support lower birth rates. The government of China and the government of India are both anti-natalist, all right? They're trying to lower their birth rates. Now, China appears to be very effective in this. There are 7 million less people that live in China since the year 1980. Now, one thing that China did was that they introduced the one-child policy. The Chinese government did this and adopted the one-child policy in the year 1980. People had to have permission to have a child. Those that were and did, they'd have to have a permit. The government granted them subsidies, better housing, longer maternal leave, in a plan and with a master plan of having less children and decreasing the population. All right. The other thing was, and you can see all these interesting little signs and posters that are posted all over China. It is a big deal. It's definitely a big deal. So from 1980, you can see on the map there when the one-child policy was implemented, 1979, 1980, you can see that the population went down tremendously. You can look at China, India, Japan, the United Kingdom, and the United States, and just see there, and you can include India as well, just to see the birth rates, all right, the total births up until the year 2017, 2018. So in China, the CBR went from 18 to 12, all right, as a result, and the natural increase rate went from 1.2 to 2.5. Now, the one-child policy was so effective that it was lifted, all right? It was lifted, and it was done away with in 2015. So China has been effective, and of course, we know other ways that they've been effective at doing this per our lessons on the documentary, It's a Girl. Now, China is said to be effective at this. India, not so much. Now, India's family planning process starts in 1952, and the government lost the trust of the Indian people, especially Indian women, from the start. Now, India's program was based around sterilizations, and sterilizations basically makes women incapable of having children, incapable of reproduction. There are surgical procedures. It is absolutely opposed, all right? The world looks down on these types of programs and so on. But one thing that it did is it allowed for families to totally not trust their government anymore, not trust their government. Now, so the effect of that was that women had more children. Women had more children and denounced the government because of this, okay? Now, the family planning programs did get better in more recent years. From 1980 to 2018, the CBR in India did change from 34 to 20. So we're talking about at the outset of the government family planning process in Italy, it was not effective, all right? It didn't work. But now they're starting to get a little bit better here in more modern times. Here's an interesting thing that India made people focus on. Here's a stamp, all right, that shows a mom and a dad and one child, okay, a small family by choice, all right. So they were making stamps, and the government was trying to do everything to try and figure this out. Now, however, the population has increased by 19 million in 2018. It was 15 million in 1980. So the population has only increased by 4 million on average across the board there as far as it goes. Okay, so China has been somewhat effective. India was not effective from the start, but basically is getting a little bit better. Now, what helps countries to improve their CBR? What helps countries to lower their population and so on? So the next lesson that we're going to talk about today is on something called family futures, family planning and so on. So the birth rate since 1990 in developed countries has dropped from 27 to 20. The birth rate in developing countries has dropped from 31 to 21. That's a sizable increase. Why? Let's go ahead and move forward with our lesson and answer the question about why have these numbers dropped compared to the past. Well, number one, there's better education. All right, people are getting better informed and have access to materials that are going to help them to understand their rights and laws and what their choices are, okay? Healthcare has improved with improved healthcare programs. Obviously infant mortality rates have declined tremendously, okay, in these places and so on. Governments have set up counseling systems for people and so on. So with the increase of people having children naturally and healthy, there's more of an effort for people to plan their families, all right, for this reason. Now, family planning around the world, you can see the methods that are being used on this diagram and in this map. The lighter colors are the ones where family planning is not being instituted as much. The darker colors are the countries that are really, really into family planning, and as far as the United Nations numbers are concerned, are doing a really good job. So basically, overall in the world, and this map shows it in 2017, there's obviously better family planning methods to control populations. Now, China is reporting the highest rate in the world. All right, the best rate in the world these days, okay? And obviously there's a little question mark right there because of their methods and so on, which as we know are looked down upon in some ways. Now, the lowest rates in the world are in sub-Saharan Africa, all right? Sub-Saharan Africa, the rates are at an all-time low because there's just no family planning methods, all right? And it's a very big problem that we're going to look at to finish the lesson today. So this is not the last time that we're going to look at sub-Saharan Africa as an example within our lessons for the day. Now, there's something called epidemiological futures. Now, epidemiological futures, but to understand this, you have to understand what epidemiological means, okay? It means that it's a branch of medicine that deals with the distribution and basically the control of diseases. We have to look at populations of the world being controlled by an increase of diseases that are popping up in the world presently today, a reemergence of certain diseases, and we're going to get into that. So the epidemiological futures is definitely affected by presently here in our world today by a reemergence of diseases, which obviously is affecting people, which is increasing death rates, which is obviously dealing with population and our population growth, okay? Now, there are reasons to explain the emergence of stage 5 of these epidemiological stages, all right? There's 3 of them, all right? There's 3 possible reasons. Number 1 is evolution. Evolution, okay? The evolution of diseases, okay? There are new strains of viruses and bacterias that are hitting our world, all right? We're going through a pandemic right now with COVID, all right? There's an interesting reemergence, and a great example that we can give of this, of malaria. Malaria in the mid-20th century was done with. It was eradicated, all right? There were hardly any cases of malaria in the world these days. Malaria is transmitted through mosquitoes that carry a parasite. Now, all over the world, people where there are malaria incidences, which is Southeast Asia and Africa pretty much, they've been spraying something called DDT in areas that are infested with mosquitoes to try to kill the mosquitoes. All right. Well, today, malaria has rebounded. All right. It has evolved. There are new strains of it that cannot be killed by DDT. There are mosquitoes and these parasites that live on mosquitoes that are resistant of the DDT these days. Okay. Malaria causes about 500,000 deaths in our world today, and nearly all of those are found in sub-Saharan Africa. Now, another way that we can explain the emergence of stage 5 and the epidemiological transition is poverty. Poverty in developing countries. Now, these places are very unsanitary. The reemergence of these diseases and such cannot be controlled by people because they can't afford drugs. We talked about healthcare. We talked about places in the world that are just not good with this, and people can't afford drugs. Now, a good example of this is TB, tuberculosis. TB is something that you are vaccinated for. Nobody these days, around really developed countries get TB. Tuberculosis is an airborne disease that damages your lungs. It's passed by coughing. It's passed by sneezing. Okay, and there is a reemergence of it. All right, especially in poor areas around the world that do not have sanitation, that do not have good healthcare systems, where people cannot afford drugs. All right. The number of cases of tuberculosis around the world is high in some places, sub-Saharan Africa, and there's definitely incidences of tuberculosis in India and in China and in the bigger developed countries with more populations, it looks like, okay? Malaria deaths in 2017, primarily, like I said, are found in tropical regions. So I'm going to tell you that Brazil, some South American countries that are tropical in nature with rainforests, and definitely sub-Saharan Africa, are where people are dying today of TB. Now, another reason why there's an emergence of stage 5 in the epidemiological transition is because of people moving around the world. Cultural diffusion. People moving, like we talked about in chapter 1, relocation diffusion that we talked about is a reason why diseases are being spread around the world. Now, the most lethal one is AIDS, all right, is AIDS or HIV, which is the human immunodeficiency virus that causes AIDS, okay? AIDS basically is going to jump on the scene in our world somewhere in the 1970s, early 1970s, and it starts in sub-Saharan Africa, okay? If you're looking at the maps, you can see the countries around the world that are affected by this to this day, okay? And then you can see the areas that are affected in the United States, okay? Today in our world, there's about 37 million people that are living with HIV. It's a disease that has been controlled through medicine. When it first jumped on the scene in the world, people were dying of it like crazy. By 1993 in our world, that was the peak of AIDS, people that had AIDS that were HIV positive and so on, okay? So today there's about 37 million people. Most of those people are formed and found in sub-Saharan Africa. Actually, Africa is home, listen to this, to 26 million of the world's 37 million HIV positive people, okay? So 26 million of the world's 37 million live in Africa. It's interesting to see Russia up there is very high with HIV positive cases there, and that map is showing you in 2016, okay? Now, the other thing that I wanted to talk about is how this lethal disease hit the United States, okay? So AIDS came to the United States from Africa in the 1980s, okay? And the biggest populations that have AIDS, even to this day, are in California, in Florida, and in New York. Now, coincidentally, In those states, there are the three leading airports for international arrivals are flown into: Florida, New York, and California. Okay, so you can see exactly what's going on there. And once again, the peak of it was in 1993. Today, through medicine and through education, those numbers are dwindling around. But you can see the maps and you can look at that and see what places around the world, and definitely what places, heavily populated areas, there are in the United States where we have people with AIDS. Now, population and resources is the last thing that we're going to talk about. And obviously, there's a correlation between the amount of people that you have on Earth and the amount of resources that you have to continue to sustain them. All right. We're going to talk about a guy named Thomas Malthus, who I've talked about in my classes in world history class during the Industrial Revolution. I've mentioned him many times. All right. He's going to be a guy that's going to live in from 1766 to 1834 in our world. Now, Thomas Malthus was a British economist that said that eventually in our world, the population would outrun the amount of food that there is in the world. That's what we call a Malthus theory, or a Malthusian theory, that the world's population would outrun the amount of food that could be produced on Earth. Now, he's going to write his findings in a pamphlet called An Essay on the Principle of Population. Basically, in this book, you're going to see how he breaks it down. And this chart does a real good job to show you for every couple persons how many units of food there's going to be. All right. So today was when he was talking about during the time that he lived during the Industrial Revolution. Everything was even. Okay. And then over the years, you can see that the number of people are going to outnumber and outrun the amount of food that's going to be on Earth. Well, obviously, Malthus is kind of laughed at today because modern economists and modern people look at him and say, well, that's never going to happen. It didn't happen. Unfortunately for Malthus, like many people that have made theories about the world in the past, they couldn't foresee and they couldn't predict the future. They couldn't predict a few things that we'll finish with our lesson for today. So even though he's kind of laughed at, there are some people on Earth today that we'll finish with that kind of are like, well, you know what? Let's revisit this theory because of the current boom in population in some areas around the world. Okay? So the one thing that Malthus had going against him was that his theories were made during stage 2 of the demographic transition. During this time in our world, during the Industrial Revolution, there was only one country in the world that was in stage 2 of the demographic transition, and that was England. So he's a British economist living in England during the Industrial Revolution, making these theories based on what he's witnessing at a very early period in our world where there was only one country that was in stage 2, and that was Great Britain. So the chart actually shows you his theory. All right, it says that population increases geometrically, which means the change in population differs from a basic constant ratio. Okay, and then he says that food increases arithmetically, which basically is by adding and subtracting and looking at food productions and so on. So you can see the yellow line is a flat line, all right, of food. And then you can see that the population line, obviously, from his theory, is going, the population is much higher than the food production. Now, at a certain point where those two lines meet, that's called the Malthusian trap, okay? So the population could increase beyond what the planet could support. But obviously, there are some things that are going to play into that. Now, one thing that he talked about was within the United Kingdom, he said that some things have to change, okay? And in order for this not to happen, the population growth, as far as pressing that against the available resources in countries, countries, in order to combat this, would have to find ways to lower their birth rates, okay? Which, as we see, could be family planning that we have today. And there had to be an increase of death rates, okay? So he foresaw disease. He foresaw famine, war, and other things that could possibly increase the death rate, which obviously would help him to denounce his theory, all right? So in order for this theory To not work, you would have to lower birth rates and you would have to increase death rates on Earth. And those are natural features and natural diseases and things like that that would help to increase the death rate, okay? Now, the last thing we'll talk about today are neo-Malthusians, okay? Because neo-Malthusians basically somewhat are against the process of Malthus, against the theories of it. So what neo-Malthusians do is they look closely at his theories because of recent population growth, okay? They have revisited this, all right? They have definitely revisited this because of the population growth that we have. Now, once again, one thing that he did not know, and one thing that neo-Malthusians argue, is that there was only a few countries that were in stage 2 back then. Today, we have developing countries that are in stage 2. So there's a big gap between population growth and resource. It's wider in some cases around the world than what Malthus had anticipated, okay? Now, the other thing that we have to worry about is that neo-Malthusians just aren't worried about food today, but now there's certain things that we have to look at, all right? With billions and billions of people now on Earth, now we have to look at water. Now we also have to look at energy. So one thing that they take Malthus's theory to another level in is just not looking at food production, but the other resources that we need in order to survive. Water, energy, and so on. Now, to finish up, let's look at and let's bring this all together and talk about some places where this is happening and why Malthus's theory probably will never come to fruition. So let's talk about the critics and let's see where they stand now. All right. So today in the world, the carrying capacity in food production has basically increased. Okay. And if you remember from lesson 1 or section 1 in chapter 2, the carrying capacity, remember, is the maximum population size that an environment can sustain, the maximum amount of people that an environment can sustain. Okay, so the carrying capacity in food production is very high these days. It's very high. Another thing that the Malthusians and the critics of them and Malthus basically are talking about is that the population has not grown like Malthus had expected. All right. He expected that it to quadruple during the half century, even in India, and it just has not done that per our lessons earlier today on India and China and so on. Now, the other thing that we need to look at are places around the world that are being affected by this, okay? So Africa struggles with carrying capacity. Africa absolutely struggles with it, okay? This map shows you, poor Africa, the amount of arable land that is there, okay? And you can see that there is not a lot of arable land. So they struggle with this. So if Malthus lived in Africa today, he would be like, see, I told you so. But it's just not the case for other places in the world. Now, their population is growing and the land cannot sustain it. And the reason why basically there's probably never going to be this problem and Malthus's theory will never come to fruition is simply because of the increase and the modernization of food production. Today, we have better growing techniques. Today, we have higher yielding seeds. Today, farmers are cultivating more land and having ideas of cultivating and ways to cultivate land that we couldn't do in the past, okay? So even though people mock and hoot Malthus, it was not a bad theory for him living in the time, but it's just never probably going to come to fruition as far as what we've been talking about in the lesson.